So I'm kind of giving the Republic of Ireland version of the Northern Ireland thing. So there's a lot there that you'll see that's familiar. And congratulations as well on your new strategy. And I'm definitely going to bring some copies back to my colleagues in the HRB. They'll be very interested in this. So just, I want to give you a quick overview of the kind of the policy and health system supports and further funding opportunities that you might have in the HRB. Again, the slides will be available afterwards. So, I mean, no need to take notes now. You can have a look, and especially the last 3 slides. There's a lot of information in them, so you can just whiz through them. So, essentially, where we fit in the national landscape, for anyone who doesn't really know us that well, there's a number of funding agencies in Ireland. SFI, the HEA and IRC, the Irish Research Council, are now all part of the Department for Further and Higher Education, Innovation and Science, I think, otherwise known as DFERS, which is much easier to say. And where they kind of sit really is in the fundamental space in, I suppose, biomedical therapy development and looking at new innovations. Then you also have, of course, the industry funders, so the Enterprise Ireland, the Department of, IDA, who do fund a little bit in Ireland, but also in the EPA, they have some industry funding as well. So they sort of work out more on the, implementing new technologies and in the innovation space, I guess. So essentially, for all of the other stuff that needs to go on in a healthy research system, the HRB funds in that space. So in the clinical research space, health services research, population health sciences, evidence synthesis, appraisals, and really trying to link into policy. And I suppose at the end of the day, we're all trying to improve people's health in one way or other, but just coming at it from slightly different angles. So we've got a lot of things that actually influence what we do. Obviously, we've got our statutory instrument that spells out, the space in which we can work. We have our funding, which, comes from the Department of Health, so it does determine how much we can do in any given year. It's an annual funding budget for multi-annual funding, which can be a little bit complicated. So we have very large spreadsheets. We're constantly moving money around trying to figure out how we can do stuff. There's also then the socioeconomic factors. There's a lot changing. There's a lot of people expecting more. There is a much more research literate health community in Ireland, and especially post-COVID. People now, PCR slips off people's tongues. I did my PhD in developing a PCR diagnostic, and I think I probably had the first machine in the country. So, people are a lot more interested in their health and in research about their health now, which is really brilliant. But of course, then we've also got, we're a funding agency, so we have to be able to account to government and to the public for the money that we spend. And then, of course, we have some key stakeholders. I'll talk about them in a minute. COVID's had an impact on us in terms of some of the infrastructure we've developed, like COVID Biobank and Data Hub with the CSO, so that people can actually get access to HSE data on COVID patients. And there's been a huge number of health reforms, launch care being one of the main ones there. So in terms of our external relationships, Department of Health obviously is a key external relationship, but DFERS is as well. So at the moment, we're all talking, for example, about PhD stipends and what we're going to do on a national level for PhD stipends. So, I mean, it's really good to work with our fellow funders across these sort of issues. The Health Service Executive, we have many different collaborations with different units within the HSE, but also we've been contributing to their development of research strategy, which is really important. Obviously, the research community is our absolutely key stakeholder, but also we've got a lot of co-funders. So again, like Janice, we're constantly looking to see how we can leverage some additional funding to add to our core budget. And, the health research charities in Ireland, the Irish Research Council, we've done some COVID funding with them. Obviously, the Northern Ireland office, both with Evidence Synthesis Ireland and the PCRN. Wellcome Trust, the NIH in the US, etc., etc. So we're always looking around for collaborative opportunities to try and get a little bit more money into our research. And we do work with other statutory agencies such as HICWA and the HPRA as well, because we fund quite a lot in the clinical space. And we're, as I say, we work with other international funding agencies in some of the transnational calls. So there's a lot of collaboration going on there. Our values, honestly, I'm not going to stay too much with this one. I think some of them are very familiar actually from the values that you were talking about, Mary. Gender equality, gender and sex in research, actually thinking about the impacts of that, not just, you know, that you've got, are trying to encourage perhaps, you know, women or just the less kind of, what's the word, represented in research teams, for example. But we're also looking a lot now at things like research assessment through DORA. How can we assess people in a more equitable way, not concentrating always on the number of peer-reviewed publication people have. We've done a huge amount of work in research integrity. Public and patient involvement is a really key thing for us. We are funding the PPI Ignite network. We really want to see it happening in our research. So, I mean, it's brilliant. It very much aligns with the strategy that you have. Fair data, open science, all of that good stuff. We're trying to kind of move on all of those fronts at the same time, which is not always easy. So we have a strategy that we're about halfway through now. So we'll probably start having to think about ours at the beginning of next year. And there are a number of different areas or objectives. One is around delivering research that actually has value for the health system and that can have some societal impact. We also want to be kind of a credible voice. So evidence and synthesis and evidence review and the translation of evidence into impact is really important within this objective. Data is becoming the big thing now. There's a lot of new regulations on data. There's a lot of push to try to be able to link data sets, not just in Ireland, but across Europe. And I think if we can achieve that through the various bits of legislation and work that we're doing, we really are going to see some very rich research coming out of that. So fingers crossed that that's going to work. We also are very much linked into the European and international space, and there is a slide at the end about that, about our cooperation and collaboration there. And also, of course, we need to have the environment in which researchers can work, so infrastructure, but also environment in terms of the culture within which people work. So research integrity will be very important there. So in terms of our funding, in the clinical research space, we fund, obviously, the clinical research centres, and we had a new kind of competition last year, so we now have more clinical research facilities, and some that are kind of getting pilot funding, you know, because they weren't quite there, but they will be there, hopefully. But it's not just about the clinical research facilities. We want to see the methodologies around clinical trials improving, so we fund the TMRN, the Trials Methodology Research Network. We fund the nurses and midwives who are involved in research in clinical trials. As I say, we have a national COVID biobank now. We fund EPOSI as well, because, I mean, that's an important way of pulling in both the patient voice, but also what industry is doing as well, trying to understand that. In terms of training capacity, we've just gotten a new EU Marie Curie PhD programme, which is around policy and public health policy, no surprise, post-COVID. So we're actually starting to recruit into that now. We've got the Sphere programme, which I think you'd probably all be very familiar with over many years. And then sort of on the clinical side, we have the ICAT programme, which was co-funded with Wellcome Trust, but is now fully co-funded by us. We've got applied research into policy and practice fellowships, collaborative doctoral awards, and other training for emerging leaders, emerging investigators, students, etc. So really trying to build up capacity in the system for actionable research That's the new buzzword in the HRB, actionable research. And then, of course, there is more specific, if you like, funding for health system, health policy translation. So we have 2 longitudinal studies, TILDA and IDS TILDA, Evidence Synthesis Ireland, obviously, which is co-funded with Janice's office. We've got Dementia Research Network, the All Ireland Institute of Hospital Palliative Care, Applied Partnership Awards, etc., etc. I'm not going to read them all out, but what all of these things are trying to do is ensure that there is translation of the research evidence into the system, be that the health system or the policy system. So, research everything, I mean, this is obviously what this seminar is about. It's about the ecosystem, really the evidence ecosystem that we have in Ireland and how we can improve that. And I mean, that's the whole context of how evidence is generated, used, and then translated. So from the sort of the research production or the evidence synthesis side, we were the first funding agency to provide access to the Cochrane Library to anybody on the island of Ireland. So HRB pays along with the Northern Ireland R&D office, we pay the subscription so that anybody can get on and have a look at the Cochrane Library. So that's, and can research it and can obviously put stuff into it. Evidence Synthesis Ireland, also co-funded with the Northern Ireland R&D office. And then we have HICWA are funded to work with clinical guideline development, so to do the actual evidence synthesis. But of course, it's way more about lots of things. But having said that, evidence and evidence synthesis, and I think this was really clear during COVID, is absolutely critical in terms of generating the kind of information that policymakers can actually use. So what else are we going to do? Well, we're trying to look at our evidence synthesis kind of space more broadly as well to see how we can further build capacity in this area, especially among clinicians and researchers who might not perhaps have the skills at the moment to do good quality evidence synthesis or evidence review. We'd really like to develop a kind of a national structured approach to this. And that obviously is going to involve building capacity among people to actually do this kind of work, but trying to figure out as well, how do we best embed that evidence then in key decisions for health and for policymakers. And in all of that, I think for some of the health system, or let's say the health delivery system and policymakers, we also want them to realise how important this is to them and how useful this is to them. So we have to think about how can we do that better as well. And there was a very interesting discussion on this at the HRCI conference about 2 weeks ago, where they were trying to think about what could we do. Could we, say, develop policy forums? Is there some way that we can make people more aware of the importance of the evidence for their work? And obviously, we want to continue our relationship with Northern Ireland to deliver on these activities, because I think they'll be richer and better if they're done on an all-island basis. So, as I say, it's not just about the evidence synthesis piece. You really do have to try and work to improve the links between the researchers and the decision makers. And we've got quite a lot of funding in that area. As I said, with the Applied Partnerships Awards, the All Ireland Institute of Hospital and Palliative Care, PCRN, would definitely be in this space as well. We've been looking with the department at frameworks for skills mix in nursing, for example. And a lot of them, there is, I suppose, longitudinal studies then can underpin some of this and provide a very rich source of data that can feed into both evidence synthesis and policy for practice. So secondary data analysis, we're really trying to encourage that. So what else are we going to do? Well, obviously, we're going to continue, and I think this is a very clear message for our next strategy. We will definitely be continuing in this space. We do want to think of ways that we can build those links in a more constructive and formalised way as well, so that people trust each other and will actually use the sort of the knowledge that the researchers understand how they can perhaps package their evidence so that it can be used by the policymakers, but then that the policymakers also know who they can go to for that evidence as well. We really do want to sort of redouble our efforts in trying to get the health delivery system involved in this, and I think that very much lines up with what you're doing in your strategy as well. We are about to next year launch a new policy research programme. So that will be done with the Department of Health, looking at Department of Health priorities, for example, in Sláinte care, and how we can actually generate, what kind of mechanisms we can use to generate research evidence. And as I say, we really do want to continue to build on our international. Now, so I am not really going to go through these other than to say that there are lots of funding opportunities in this space. And just because something looks like it mightn't necessarily support palliative care, end-of-life care or whatever, that is simply not true. We are open in all of our schemes practically to any topic. So if you can make a good case for it, we'll fund it, basically, is what I'd have to say there. And as I say, these slides are available to you. And don't forget the European programmes as well. There's some very interesting joint funding opportunities that we're co-funding with other funding agencies across Europe. And we have some partnerships as well. So, as I say, I'll leave it there because you'll get these slides anyway. So thank you very much for listening.